Good afternoon, everyone. This is Sharon McKinley. I am the Senior Consultant with the NRC for InHome Services, which is funded by the Department of Health and Human Services Children's Bureau. And I would like to say on behalf of the NRC for InHome Services, welcome to Promoting Safe and Stable Families Peer Learning Call today. Today's topic is on family preservation as it relates to promoting safe and stable families. But we're interested in learning about it from a full perspective. Before we get started, can we find out who is on the phone this afternoon? And so if you could state your name and what state you're from. And just to kind of get some order here, can we start with region 1 through 5 first, and then we'll go from there? How about that? Because that way we won't talk over each other. Anyone from region 1? Anyone from region 2?
I think I'm region 2. South Carolina, I'm not sure.
Oh, you're 3.
3, okay.
3 or 4.
Right. Take it back.
Okay, and you want to introduce yourself?
Oh, you want me to go ahead?
Yes, ma'am.
Okay, region 3, Linda Love, Catawba Indian Nation, Social Service Director.
And you're from the state of?
South Carolina.
Okay, that's 4.
And we service tribal members in North Carolina as well.
Okay. Anyone else from region 1, 2, 3, or 4?
Lindell Lewis, Virginia.
Okay. Anyone else? Region 1, 2, 3, 4, or 5. In case you're, that would be like New York, Pennsylvania, Delaware, Virginia, Chicago, Illinois would be. Yeah. North Carolina, South Carolina, Florida, Georgia, Maryland.
This is Carrie Finkbeiner from Wisconsin.
Wisconsin? Say your name again?
Carrie Finkbeiner.
Okay.
I just got on. My name is Leona Leonard from the Navajo Nation, northeastern Arizona.
Okay. Region 6 through 10, and that will be the Midwest through the West, I guess you could say. Texas and Louisiana and California, Washington.
Hi, this is Jill Jordan from Colorado. Terry McDaniel from Prairie Band Potawatomi Nation in Marietta, Kansas.
Okay, hold on. Say that again from...
There was Kevin Higgins, Montana.
Okay. And then
Who is on from Potawatomi?
Terry McDaniel and Nina Hines.
oh, okay.
Great, thanks.
Thank you. Okay. Anyone else?
This is Carolyn Bland from Mississippi. I'm with the Department of Human Services, and I manage the Comprehensive Family Support Services, which is a family prayers and family reunification service.
Okay. Anyone else join us? We're introducing ourselves, our name, and the state you're from.
Okay. Are you waiting on me? This is Tasha Smith from Mississippi as well.
Oh, Tasha, how you doing?
Great.
I don't know if you heard me. Can you hear me?
I can hear you now.
Okay. Leona Leonard with Navajo Nation, northeastern Arizona.
Yes.
Okay.
Thank you.
Okay.
Okay. Anyone else? Join us. Introduce yourself. Okay. Before we introduce our presenters for today, in order for us to hear them clearly, it would be really nice if you all could mute your phones, and you do that by hitting *6. If you have your phone, you can just unless you have you already on the phone. Thank you. Thank you. Wonderful. I did send out the material for today, but it will also be posted on NRC for InHome Services website. I will send out an email to inform everyone when that will be. Also, at the conclusion of today's peer learning call, we would like to hear from you so that we can make sure that we are improving and providing the topics that you would like to talk about. So I will be sending out an email at the conclusion of the peer learning call for you to take a brief little survey so that we can, know what we're doing right, where we need to improve on, and you can also make suggestions on possible topics for the future. And just to let you know, we are planning to have 2 more peer learning calls. In August, we're planning to have it on community-based family support services on August 20th. And then we're planning to have one in September, sort of like closer to the end of the last week in September, and I'll give you the date soon enough. Oh, September the 25th, September 25th. Okay. Now, on to our presenters. Today, we have, that will be starting off our conversation, Bonnie Warchek. She is a coordinator for the NRC for InHome Services Training and Technical Assistance. She is serving as a primary liaison with states and regional offices in coordinating the work of the NRC for InHome Services. Just so you know, Bonnie retired in 2009 as Deputy Director of Missouri Department of Social Services Children Division, where she worked since 1978, beginning as a case manager with Protective Services. She also has practice and experience with child abuse and neglect investigation, foster care, and TISM home services. And also, Bonnie was promoting safe and stable family liaison through the agency. So she has a wealth of information, and she also served on the board of the National Family Preservation Network. So we're looking forward to hearing from her. And then we also have Christy Collins, and she is the Safety and Well-Being Unit Manager for the Children's Division in Missouri. She is responsible for safety and well-being programs of the division, including the supervision of 6 staff. Christy has been employed by the agency since 2003 and has served in several different capacities. And she has her master's degree in psychology and has worked in the area of family preservation since 2008. And then last but not least is Tim Kelly. He is the performance-based contract and evidence-based program manager for the Children's Administration in Washington State. His responsibilities include the contracts that the Children's Administration uses to purchase several service delivery in the family home to prevent the need for out-of-home placement. Tim has been employed by the Children's Administration since 2003, and he has his master's degree in developmental psychology. So we welcome them and we thank them for taking the time to come to us today and talk about family preservation. So I'm going to turn this over right now to Bonnie, and you can have the floor.
Thanks, Sharon. Good afternoon, everyone. Thank you for taking the time and sharing your time with us this afternoon. First, I'd like to just remind everybody that the term family preservation covers a number of different models of working with families to preserve the child with their family and do that in a safe in a safe environment. Intensive family preservation is just one of those. Models directed towards a specific population. Sharon, next slide, please. The Homebuilders Model is the program model most closely identified with intensive family preservation. Homebuilders has been given a scientific rating of 2, supported by research evidence by the California Evidence-Based Clearinghouse for Child Welfare. And although this research has, it's been wonderful to have some research that supports the IFPS, but it's still felt that there is some additional evidence that needs to be found, which includes the types of family-based programs that are most effective with different client subpopulations, and also the effectiveness of IFPS with different age groups of children. That's just 2 of the several that they're thinking that they want to look for some more evidence. Next slide, please. Some of the supported outcomes of IFPS are to avoid out-of-home placement, reduce subsequent maltreatment reports, increase social support, decrease self-reports of domestic violence. However, the typical 60 to 90-day duration may not be adequate for families with serious and chronic mental health or substance abuse. Best practice indicates short-term IFPS followed by longer-term aftercare services. There was a meta-analysis conducted by the independent Washington State Institute for Public Policy in 2006, and it identified 14 studies of intensive family preservation services with rigorous experimental designs and concluded that intensive family preservation services programs which follow the Homebuilders Model significantly reduced out-of-home placement. And this is a very important milestone in the research on intensive family preservation, because for many years it was anecdotal, and those who were working with IFPS thought that, but it is really good to have that evidence behind it. There's another research paper that you all might be interested in, and it's in the bibliography. I'm not going to go into it, but it's titled A 10-Year Review of Family Preservation Research, Building the Evidence Base, by Casey Family Programs in 2009. And again, one of the handouts was a bibliography for IFPS. It's in that bibliography, so I would strongly recommend perusing through that. Now I'd like to move to the next slide and just go over some of the essential components of an IFPS program. And of course, you'll see that some of these are, applicable to any program when you're working with families. The engagement of families and making them part of their intervention. The assessment and goal setting, which includes ongoing safety assessment. Behavioral change interventions. Skills development. This is very important, of teaching the parents how to react to everyday situations with their children, how to go out and advocate for themselves, those types of things. Concrete services. This is found to be a really important piece, because oftentimes families have a difficult time moving on and dealing with some of the harder issues if they need something like a refrigerator to keep food to feed their families, those kind of things. So it's been found that concrete services are really important. Community coordination, immediate response to a referral, and 24/7 availability. That's another biggie. Intensity of services, 8 to 20 hours per week. Service provided in the natural environment, and caseload sizes average 2, maybe up to 5. Flexibility and responsiveness, and typically is a short-term intervention of about 6 weeks. Next slide, please. There have been several surveys completed by the National Family Preservation Network, and the National Resource Center for InHome Services partnered with the National Family Preservation Network to survey 50 states regarding implementation of intensive family preservation services with fidelity to the Homebuilders Model. This was a follow-up to the 2007 survey. And the purpose of that survey was to inform child welfare agencies about the extent to which states continue to provide intensive family preservation services and the variation in programs and how it's changed since 2007. Next slide, please. This survey report includes characteristics of exemplary IFPS programs nationwide. It has a first-time look at an adaptation of IFPS principles for safety services. information from survey respondents providing less intensive family preservation services, and a directory for resources, training, and technical assistance to implement IFPS with fidelity to the Homebuilders Model. The expectation of that survey was to help states that are considering establishing a new IFPS program or wishing to strengthen their existing programs, that they could benefit from seeing how other states are implementing IFPS across the country. The results of that survey were, among those that completed the survey, 27 states reported implementing some form of intensive family preservation. There was substantial variation in IFPS programs at the state level. In 2011, 14 states were implementing IFPS with fidelity to the Homebuilders Model, where in 2007 there were 20 states. So there are less states in 2011. However, there is currently more uniformity of standards in the exemplary IFPS states than there was in the prior survey. Next slide, please. The characteristics of the exemplary programs were that the IFPS programs were offered statewide to reach as many families as possible in the target population. The most exemplary IFPS programs are well established, having been in existence for 5 years or longer. At least a quarter of all families served by IFPS include older youth ages 12 to 17. And all of the exemplary IFPS programs offer reunification as well as preservation services, and most are based on the same model. And safety continues to be the hallmark of exemplary IFPS programs, with most states reporting no deaths during IFPS interventions over the past 5 years. In closing, the state administrators can use the findings from this report to compare their state's in-home programs with the programs listed in the charts. They can determine where their state fits and readily identify examples of how they might evolve their programs based on what other states are doing. And then to help your jurisdiction establish or strengthen intensive family preservation services, a resource directory follows the reference section. And the report will be available on the NRC IHS website soon. I'm sorry I just had to read to you. I know that gets kind of boring. I couldn't memorize the whole report. It's a very interesting report, and there's a lot of charts that really take a lot of study. So it will be on our website soon, and I hope you all take advantage of that survey. I think it will be very helpful to you. Another thing that we have found is a new blog that's being hosted by NFPN. It's very interesting. I've gone to it several times to look at what different states are talking about and different individuals are talking about and asking. The blog was designed to prompt conversation about what's happening in IFPS on both coasts and in between. The posts include news and information, opinions, questions, and surveys. Because there's so much knowledge within the IFPS community, but we don't often get to talk to each other and share all that, and then support each other. It's kind of like a peer support network, so to speak. It offers them a place to meet, talk, and support each other. And together, practitioners can advance the field of IFPS through shared information and increased awareness. And you'll notice that the website for that blog is on the bottom of that slide. And if there's any information or further information that you would like, you can contact me. This is my contact information. Are there any questions?
I think we're going to wait until...
We're going to wait till the end, okay.
Yes. So we're going to turn this over now to Christy Collins of Missouri.
Hi, everybody. Next slide, please. In Missouri, we call our intensive family preservation program intensive in-home services. Basically, it's a short-term, home-based intensive crisis intervention program, which we work with families to try to divert children from entering foster care by providing families with additional protective capacities, capabilities in order to keep their children safely at home. The purpose, obviously, is to maintain children safely in their homes whenever possible, recognizing that there are times when it might be necessary for children to be placed in foster care to maintain their safety. Missouri's program follows the Homebuilders Model, which Bonnie talked about previously, and we've been pretty strict with following that model ever since we began. Next slide, please. The first Family Preservation Services program began in Missouri in about 1987, and by 1992 the program was available statewide. The name was changed to Intensive In-Home Services in 1998, and we call it IIS for short. Next slide, please. We are proud to say that these services are available to all of our circuits within the state of Missouri so that every family has equal access to this service. Currently, the program is provided through contracted providers across the state. We have a competitive bidding process along with a contract, and they submit proposals, and we review those proposals and determine who is selected to provide the service. Previously, this service was also offered in-house, but due to funding, those positions were cut and now it's completely contracted out. The program is funded by Children's Treatment Services and charged to our Title IV-B federal grant. Next slide. The population served typically is any families with children from birth to 17 years of age who meet the eligibility criteria. We require, as a state agency, a referral to this program for all cases when a worker is recommending the removal of a child. So we want to try to provide those services to keep the child safely at home when we can do so. If in the event the child is removed, maybe it's the middle of the night or some kind of emergency situation, we can return the child home with IIS up to 72 hours after the removal. So if we think there are services that could be put in place rather quickly to keep the child safe, the service allows us to go that way as well. Next slide. Typically, the intervention is 8 to 10 hours a week of face-to-face and or telephone contact with families. Typically, in the beginning of the case, it's more hours and more intensive with the family, and then we try to wean away from the service as we get to the end of the intervention. Typically 4 to 6 weeks in duration. We can get approval to go beyond the 6 weeks if there are extenuating circumstances. A specialist carries up to 2 cases at a time, and they're required to screen the family within 24 hours of referral. Currently, our IIS information is contained within our state SACWA system, so the Children's Division worker will make a referral in our system, and the contracted worker will get an alert where they can see that a referral has been made, and then they're required to work with us to set up the initial screening with the family. We provide an assessment with the family to determine what our service plan is going to be, and we use the North Carolina Family Assessment Scale, the NICSIS, and we've used that for several years now. Next slide. So after we conduct the assessment, we deliver services designed to address those specific needs that were identified in the assessment process. The IIS specialists teach families various skills, including problem solving, any other kinds of parenting education, budgeting, modeling, coaching families, all of those things that will assist the family in alleviating the issues which place the child at risk of removal. Next slide. So just some outcomes for our program. Every year we do an annual report of all of the different service providers that we have in the state to determine where we're doing well, where strengths and needs might be. In FY12, which for Missouri runs July 1st to June 30th, 1,742 families were served, with 3,549 of those being children that were accepted into the program. 79% of the families remained intact at the end of the intervention. Less than 1% of the families served had a substantiated hotline report within 3 months after the intervention. So we find that our program is very successful, and we've had stable outcomes with the program for several years now. And I know our court systems and all of our service providers are very happy that we have this service. So anyone who's interested in additional information about our program can contact me on the next slide.
Thank you, Christy. Okay, Tim?
Yeah. Hi, everybody. I'm Tim Kelly from Children's Administration, Washington State. Next slide. So in Washington, kind of sitting back at 2007, we looked at what we use for InHome, which is family preservation, which is kind of the top slide. I think we dropped a marker there. Family preservation services is a long-term, typically 4 to 6 month intervention. Again, looking at placement prevention or placement reunification, and we try to highlight it, some of those hallmarks. The other one that we had was family preservation services, and at that time in 2007, it lasted up to 3 months. And we took a hard look at what kind of outcomes we were achieving, and for the traditional family preservation services, we found that there was no effects, no benefits basically in delivering the service. Families who did and did not get the service, we weren't able to make a serious distinction between those. And then with our IFPS, which Homebuilders started here in Washington State, and we were informally using the model and then weren't. And so in that period where we weren't formally following the model, we saw that less than 60% of the families stayed intact. So next slide, please. So you know, as an agency, we felt very challenged by those outcomes. And at the same time, we were entering a larger initiative to look within Children's Administration to adopt services with evidence. So evidence-based practices was both internally in our legislative and within our community was becoming a focus about how to improve the outcomes. As a result of that, in 2008, we formally adopted the Homebuilders again through a competitive procurement. And then the other piece that it took us a little bit longer. So again, you know, we adopted it just like pretty much all the slides and presenters have talked about it. You know, 2 cases, 30 to 45 days. I didn't hear the other presenters mention it, but we also maintain a relationship with Homebuilders or Quest and purchased Model Fidelity, which within Washington State is basically a state requirement for us in delivering evidence-based practices. We've had research to show that without purchasing Fidelity support, therapists tend to drift and you lose outcomes. So we've really emphasized that. Moving from there, it took us a while to find something for that longer intervention, because with Homebuilders, as the first presenter was talking about, it's not always simply enough. It's a brief intervention and looking for a longer standing intervention. So recently we worked with PPP and adopted and incorporated the PPP model into our family preservation. So we have still a 4 to 6 month intervention that the backbone of it is the delivery of PPP, and we train to level 4, which is the InHome. We train to Pathways, which is child welfare, and for teens. So we have this service that allows us to serve from birth to 17, I believe, and supports the therapist in focusing in on not only, you know, behavioral and family dynamics, but also those dynamics associated with child abuse and neglect. So next slide. This is something everybody's already been talking about. The outcomes that we're finding within CA is that 80% of families stay intact. One of the places that we're focusing on now is really trying to understand those families that receive the service and their outcomes as compared to those families who receive the service require a subsequent service and the differential outcomes and trying to understand the difference in those families and those dynamics. Next slide. Here was triple P that I was already talking about earlier. What's unique about what makes this an enhancement and required Children's Administration to work with triple P America. As you can see, the second bullet says 12 hours of case-related activity. We've been implementing since about 2006, I think, or 7 evidence-based practices. And one of the things that we've learned is in supporting families on the front end and preventing placement, that one area that evidence-based practices, others outside of home builders, tend to run into trouble is that families are experiencing a high amount of chaos by the time they reach our doors. And so we had to work on, and that results in a fair amount of dropout. And so we work to integrate what we call 12 hours of case-related activities, and this ability to kind of help stabilize the family so that, in this very brief way, so that they're able to better engage in the service and hopefully achieve the outcomes that the service has been evidenced to achieve. So unfortunately, it's been very early. I think we've just trained, we're just getting ready to train our 3rd cohort of providers that will bring us up to about 60 providers in the state. We're scheduling to look at this, at any kind of early outcomes this time next year. Next slide, please. The other big piece for us in getting families, when we look at this, and having more than one service, is really supporting our social workers in understanding how to match the needs of their families with the service. When we had just FPS and IFPS, it was the context of the family situation that tended to drive the decision. Now, here in Washington, we have, I think, 6 evidence-based practices that sit on the front end of service. And we've learned over the last couple of years that really what's critical also in this dynamic is supporting social workers and understanding how to make those decisions. And so some of the highlights are we've been creating training curriculums so that we can make people aware of just, some of these EBPs, as probably many of you know, have some pretty slight differences and subtleties that kind of separate them, and at times it can be overwhelming. We've also developed this a web-based tool that we've found to be very helpful to social workers, where it brings all of our services together, describes what they do, who they serve, when it should be deployed, how it supports a safety plan, how it intersects with our 17 safety threats, and then allows them to do a directory of sorts. Right? It has the referral form. It has people listed by counties across the state on who to contact. And then I think that's it. Next slide. Or is that the end? That's the end. If you have any questions, feel free to call me.
Okay, well, we have come to that part of the peer learning call where we have, if you have comments, questions you want to ask Tim, Christy, or Barney, please do so. And then also, if you want to share what you all are doing in your state in regards to family preservation, whether you want to, share what type of model you're using, and as Tim has shown that they're using triple P along as well as the home builder. So, you have 2 separate type of programs going on here. So you can unmute your phone by doing *6, and please join in the conversation. We do want this to be an interactive. It's peer learning, so that means, sharing with one another, okay? So *6 your phone. Let's join in the discussion.
And Sharon, this is Tim Kelly. Just to clarify, we actually have 6 interventions that we use for family preservation in total. We just focused on these 2. We use safe care, parent-child interaction, functional family therapy, incredible years, and then triple P and home builders, like I said.
So now, all of those are part of your family preservation pieces?
Yes, ma'am.
Okay. That's interesting. Thank you. Questions? Comments? *6.
This is Pam Day with the NRC. I did have a question for the presenters. Christy, you mentioned that your your program is funded by Children's Treatment Services, and you mentioned that was 4B. Is that correct?
Yes.
Primarily, is that 4B Part 2 or some Part 2, or is it more than one part of 4B? I was just curious because this is PSSF, whether you're currently using any PSSF funds to support family pres.
No, we are not using any PSSF funds, but I believe it is the Part 2 that we do. Every year we do a write-up as part of our Title 4B plan, the ASPR we submit. We have to provide information on what we're doing because we receive those funds.
Got it. And Tim, do you happen to know whether you all use PSSF funds or what funds are used primarily to support family pres?
So we use the PSSF funds, or PSSF, sorry, for technology support for our social workers. We use 4B2 funds.
4B2, okay.
Is Carolyn Blanchard from Mississippi? I think you mentioned that you are with the Comprehensive Family Preservation in the state of Mississippi.
Yes, ma'am.
So what is it that you all do? How you are into implementing family preservation there?
We contract out with an agency that provides both the family prayers and the family reunification. Our family prayers program is 4 to 8 weeks, and it's based on the Homebuilders, social learning, and family reunification is from 12 to 16 weeks. And much like the other programs that have spoken, we are trying to keep the kids in the home if at all possible while they're safe. And we try with the reunification to expedite the return.
And Carolyn, are you using a Homebuilders approach for family reunification as well as preservation?
Yes, it's based on the Homebuilders, but we use the NECFAS as part of our assessment. But it's also geared toward social learning. But our provider handles all of the actual service itself, and they provide the assessments and all of that to us.
Okay. Kevin, is Kevin Higgins still on the line?
Yes, I am.
So what are you all doing in the state of Montana?
We're actually getting prepared for our waiver at this point, and we're looking at using SafeCare. So that's why I actually posted the question online. If he could give me some directions to where to find SafeCare information.
Okay.
University of Georgia.
Okay.
Yeah.
You know, I would love to. We've been implementing that for quite a while, and we actually have a Kimberly Shoecraft is a certified trainer by University of Georgia, and I'd like to offer up her for consultation for as my work partner. She's been incredible in implementing SafeCare. You know, she was a social worker for 8 years, CPS, and then CFWS, and has just done an amazing job and could be, I would think, invaluable to any state.
Okay.
And looking to start it up and to do it because we've made a lot of mistakes.
Okay.
They've made and done a lot of learning.
Is there contact information or?
Yeah. I can send it out because I have it on the website as well. But if you have any direct contact numbers, Tim, you want to share, you can either email it to me and I can send it out to the whole
I'll do that.
Okay.
Do that as we speak.
Yeah.
Sharon, this is Carrie Finkbeiner from Wisconsin. And I mean, any of the presenters can answer this question, but I think a common problem that we see is that our preservation programs work in terms of addressing the immediate crisis and safety issue, but then in terms of addressing some of the root problems that families are facing and getting them to the appropriate services quickly enough so that they're able to kind of stabilize in family preservation, and then in that period get referred to higher-end services that will actually address the underlying issues that probably contributed to the maltreatment or the issue to begin with. That's a huge problem in Wisconsin, and I'm just wondering if with any of these states that are moving these programs forward, if they kind of make that connection intentionally with their family preservation programs, so that it's so that the service kind of connection for families is less disconnected, and that they're not waiting for long periods of time for referrals, for example, for like trauma or alcohol and other drug services or whatnot.
Anyone on the call?
Well, I'm happy to jump in first. So, it's depending on where you are within the system for children's administration here in Washington State. We've had very strong partnership with our mental health and Medicaid. So if you're a foster child, I think that's partly what you're getting to. We have a fairly large supply of Medicaid providers who will provide, for instance, trauma-focused CBT. I think part in what I hear you saying is a piece why children's, we still have the traditional, what we call FPS off the shelf. But I think the things you're talking about, are the discussions that we had when we adopted things like Incredible Years, which, when you look at its source, is really a mental health intervention for little kids, right, with behavioral problems.
Right.
But, that's a key piece that sits behind a lot of the difficulties our families face. So when we look at parent-child interaction, Triple P now, we had Triple P as a standalone, and then we incorporated, like I talked about. I think that's what we've been doing. We continue to work with our mental health partners and with Medicaid. Medicaid recently here in Washington, they've figured out, and they've found providers to deliver FFT and to gain access to trauma-focused CBT, as I talked about, and Incredible Years. And I think it's through those partnerships that, because we absolutely agree with what you said, that's going to be the key that we believe to long-term success.
Yeah, and we're trying. I mean, we're introducing TFCBT across the state, but first of all, it's slow-moving, and then it's introduced to a number of different types of providers, and we try and target both outpatient services and like in-home family preservation services, so that family preservation teams have a therapist on their in-home team that is trained in TFCBT and can offer it to the family at home. But it's slow, and we don't have any policy in place or any kind of mechanism to say to our FPP providers, hey, we understand this is a challenge, and here's how we're going to address it. We want all teams to have, a clinician trained to provide these services so that there's not that gap.
Right.
So, but it's slow, and there's, of course, different ways to go about it. So I was just curious.
This is Bonnie, and I want to speak from my experience in Missouri. I don't want to step on Christy's toes. I've been gone for 3 years, but also some of the information I learned when I was on the board. But some of that it actually comes over time, like when the survey found that some of the exemplary programs had been in existence for a while, because I think what happens is those programs develop relationships with the local providers, and that that they're teaming with them from the very beginning. And so I think yes, and in the state of Missouri, they have a wide that's the Children's Treatment Services. Those are the funds that provide all the services. So Missouri does have a well-established provider network. The other thing is the training of the individuals who do the family, your family preservation specialists, the training that they get. Some states do a lot of extensive training, helping those specialists be able to break down the crisis, deal with the crisis while they're looking and assessing the family for the appropriate services. So I think sometimes then it's in the professional development of the staff to be able to actually deliver some intervention while the actual service is being set up. So I think there's several things that you have to look at and address, and of course it's not all going to just fall into place if you're building a new program from the ground up. But I think that those. Christy, do you have anything to add from Missouri on that point?
Nope.
Okay.
No, you said it. That's accurate.
Yeah, I think that's a really good point. I think when a family preservation program operates really well, there's this period when families just feel really supported, and then they're open to those kind of next step services. And it's great when you're able to kind of partner in a way that is really efficient, and then kind of capitalizes on that kind of. It's almost like that sweet spot for families where they're feeling really connected and supported, and maybe they're more willing to pursue those services than they have otherwise. So thank you for the comments. I appreciate it.
Well, you opened up a whole other door as well. If we talked about some of the things that they're doing, but what are some of the other challenges in implementing family preservation? I mean, we're talking about dealing with the crisis situation right up front, and then then looking at all of the other chronic issues that still lingers around. And we are to look at how we are reassessing what we are doing. Is it working? And if it is working, how can we tweak it to do better than what it? How can we enhance it? So, what are some of the other challenges in implementing family preservation in your state? And if you haven't already joined in the conversation, please do so. We want to hear from you as well. Virginia, I don't know if it's Tennessee or one.
Sharon, there's one other thing I'd like to add in response to Wisconsin's question. Is the other thing that's really important is for the intensive family preservation specialist to be able to recognize when the situation is too serious for them to be able to say, we think this child can be maintained safely in the home. But that calls for a good assessment of the situation. But the reason that's important is that if that happens, you have got more evidence. You're not making a kind of decision that a child needs placed. You're making a more informed decision. So it doesn't mean that every family that's referred to intensive family preservation is going to be accepted, because the situation may require that the child be placed. And so they have to be able to recognize that. But then from the state point of view, and from the court, it's a more informed decision of what needs to happen. So you're on better footing from the very beginning.
This is Pam Day with the NRC. I'm also curious about the tribal folks on the call, and if where you all are with. I know that often tribes may have fewer resources or access to fewer services. Any comments or thoughts or questions from? I know we have Navajo, and I think I heard Catawba at least on the phone. You're still with us?
Yes, this is Linda from Catawba, and we, as I said earlier, before some of you may have joined the call, we are trying to enter into preventive in-home services with Growing Homes. It's a South Carolina coalition for strengthening families, and the drawback is it calls for a bachelor's level and master's level to do the safety and risk assessments, the assessments. So we're going to try, but it's going to be a hardship on because we have only 2 master's levels. But we're going to try. But the caseload should not be high. This program will give us a window to work with families before they are substantiated for abuse and neglect. They check out as low risk, moderate risk, on the safety and risk assessment. So we will pick them up and step in, and hopefully they won't be high risk. But the drawback is having the qualified staff and the time, finding the time to do it. But I think it's going to be worth it, and it's going to cut back on trying to find placement for children, create foster homes, and dealing with that ICWA piece. So that's pretty much where we are at Catawba.
Thank you.
Anyone else? Anyone else want to share what they're doing in their state? Some of the challenges or success outcomes? Jill? Is Jill Jordan still on the line? No. Maybe they're gone. Maybe she's gone. It's okay. Is Lindell still there? Okay. Okay. Well, if there aren't any other questions or any comments, I want to thank Bonnie and for being a part of the conversation, and for those who joined in to share how they are also implementing family preservation. We appreciate that. I want to stress that the peer learning discussion, it is for you all to have a discussion and to share and hopefully learn from one another. And if you have any suggestions on future topics, please do not hesitate to email me. Having said that, I thank you, and you all can have a wonderful afternoon. You have like 10 minutes extra time.
Thank you, Sharon. Thank you.
You're welcome.
Bye.
Bye.
The host has left the meeting, so at this time, the meeting will come to an end. Thank you